Yes. It's up against, it's butt up against the wall and open the legs up. It's never have found anybody who would actually do this when I ask them. But it's an option. Okay? Come on guys, shut up. Thank you. This is an option for you if you want to use it. Gravity helps. It's maybe good for people who are tentative about stretching, but it's in your book, so that's your option. The one that I tend to use is the side lunge. And what I like about this one is if you have anterior adductor restriction, do I want the hip in flexion or extension?
Anterior flexion.
If they're extension, there you go. So I can step forward with the side leg, and now I can bias my anterior adductors. If I have a posterior adductor, the adductor magnus, the posterior head, I can put this leg a little bit in flexion as I sit. Okay, so I like this one a little bit better than the other one, where the hips are flexed. Bernie. For the love of God.
Why is everything
We're on camera, man.
You're just zooming in.
Yeah, I'm zooming in hardcore.
Does everyone remember this one from gym class? Okay.
I love this one.
This one's good and everything, but what positions are the hips in?
External rotation.
They're in external rotation, but what? Look at Eric. Look at me. Where are the hips?
Posterior flexion.
Flexion. The pelvis could be in posterior pelvic tilt, but if your hips are in flexion and you're stretching your adductors, are you really going to get the anterior adductors? Maybe, maybe not, but probably not. So again, an option, depends on the situation. Maybe your patient can't do a side lunge. Maybe this is the best they can do.
You're just not supposed to do the butterfly. Isn't that terrible? You're not supposed to actually
Like
flutter.
flutter. Terrible for, like, what if you have a goal for it, then it's fine. If you have no goal for it, you know. I don't like saying things are terrible unless I know what the purpose
I just always
is.
thought it was stupid.
Yeah, well, you can definitely call anything stupid. All right, so very, very last thing, hip into internal rotation. You can just have them use the weight of their leg to pull them into internal rotation. You can, I don't have a picture of it, but you could basically do the same thing for external rotation. Okay? Those are your HEP stretches, what you would give your patient to do at home. Or if you're in a very busy clinic and you can't manually stretch them, these are your go-tos. Or if somebody has questionable hygiene and you really don't want to touch them, you can give them these exercises. You'll encounter a bunch of different things. Hamstrings for the home program, there's a bunch of different ways. You probably all know how you can stretch your hamstrings. There's the doorway option where your leg is up on the inside of the door and the other leg is through it and you're holding it there. There is the, I can't probably do it without rounding my low back, but there's that one as a home stretch.
That's why you guys stretch your work pants.
Yeah. Oh yeah, Athleta. I just can't do it because of the height. But this is not the stretch. This is a sciatic nerve stretch. The sciatic nerve doesn't like to be stretched. This one, I think it's like that. It's in it, yeah.
You look very comfortable.
Probably not. So
Anterior gap.
it's in the book. So it's here. But make sure they're not rounding through their low back.
Too much anterior gap.
Okay, remember when we talked about dynamic stretching?
Yes.
So this is actually your patient moving themselves through hip flexion to stretch their hamstrings.
And why would we prescribe that over just if it worked better for them?
Yeah, I mean, it could be that it works better for them. It could be that you're doing this more as a warm-up to like a soccer style kick where they're going to have to move through. So you want to add a little bit of an active before you go into ballistic to get them to move through the range appropriately without gives and to give a slight stretch.
Okay.
Not now. How about after? Because it's in one of the lectures. All right. There was a study that showed standing and supine hamstring exercise or stretches were basically the same. Some of you did a cat, at least one of you did a cat on different stretching positions and found that one position was better than the other. So that just goes to show you that we reviewed one or two research studies, but there's plenty of others out there that'll show the exact opposite thing, which is why systematic reviews and meta-analysis exist for us. But the other thing that you have to make sure of is it actually accomplishing what you're trying to accomplish? If you're blocking the stretch in any way in a different position, yes, that position is not going to be as effective to stretch. Okay, so in way of hamstrings, the research is showing us As long as you're stretching the hamstrings, guess what? You're gonna get a stretch on the hamstrings and it's gonna be effective. So it's common sense.